My name is Homer VanderZaag. Currently, I'm the president of H.J. VanderZaag Farms Limited. I'm a second-generation potato grower. This is where my mom and dad started farming, where I grew up. My mom and dad came to Alliston right after the war, together with my dad's brother. Those two families became the VanderZaag clan, so we're already the fourth generation of VanderZaags. I wouldn't even know the number of grandkids, 50 or 60 perhaps. My dad was a quiet but hardworking, earnest man. Farming was his life, the mentor for our whole family. Basically, my son Garrett and my oldest daughter Karen are running the farm now, and nice to see the next generation taking charge and taking over. I was born in Alliston in 1963 at Stevenson Memorial. All of my kids were born there. It's really been a continuous part of my life. I wouldn't be able to count how many times I've been there. My wife Deanna is amazing. We met 5 years ago and we're married 4 years ago, and my partner in everything and joy to do life with. Shortly after our wedding, I started having some headaches, and then my wife noticed that I was missing some words. She insisted we go to the emergency on Monday morning.
So they did a CT, and we waited in the room for a little bit, and the doctor came back in and said, "I'm sorry, but we found a tumor." And she went on to explain that she had already made phone calls to a surgeon in Toronto. And she said we probably needed to go to Newmarket for an MRI. I started making phone calls to the kids, and through tears and shock, told everybody what was going on, even though we didn't really know what was going on yet.
When they did the surgery and removed the tumor, it was determined that it was melanoma cancer, which was actually already stage 4. So they had given me like 4 months or less to live. So that was a very strange place to live with that. I thought getting married was the big change in my life, and then my daughter had just given birth to my first grandson, and my kids were just in the process of taking over the farm, and life was just beginning, and it felt like life was falling apart.
So it was a crazy year. Following the surgery, there was radiation and started immunotherapy. There's CT scans and MRIs every 3 and 4 months. There was a second bout of cancer that they found in his liver.
My life went upside down and went up and down and down and up, and now here I am 4 years later, and just this January, the oncologist in Toronto said that having made it this far, I have a 95% chance of 10 years plus, which in my mind is the same as 30 years plus, so that's the way I'm living. So I'm very grateful.
Oh, it was a miracle. It was definitely a miracle. We thank God, and we thank for everybody that prayed for us. We thank the medical system, and especially Stevenson. And had we not had that first CT that day, and he had waited 2 weeks or a month before he could get a CT, he probably wouldn't have been here today.
We just had our third baby. Our daughter Abigail Harriet Exton was born at Stevenson Memorial 2 weeks ago. Being able to meet Abigail and experience another new baby is so special to us. We're so blessed that he's here to meet her.
He just never was going to give up. He just wants to enjoy it all, and he will.
Stories like Homer's are both heartwarming to hear and inspiring. As a physician who cares for patients in this community, I've seen firsthand the strengths of Stevenson Memorial Hospital, our incredible team of staff and physicians, and their dedication to patient care. I've also seen some of the challenges our patients face when critical services are not available close to home. Part of Homer's journey was traveling out of area to receive an MRI. That is why the redevelopment of Stevenson Memorial Hospital is so important. One of the most significant advancements, expanded diagnostic imaging services, including an MRI suite. Faster access to MRI services means earlier diagnosis, quicker treatment decisions, and better outcomes. It means less time on highways and in waiting rooms far from home. The new hospital facility will more than double the size of our hospital, triple our emergency department space, and feature all 100% single occupancy patient rooms. 2 new state-of-the-art surgical suites will be featured with an endoscopy suite that is OR compatible. The 3rd floor of the facility will house our new obstetrics unit with bright, new, family-friendly spaces. An elevated helipad will enhance flight safety and ensure that critical, rapid patient care and transport is available 24/7. I truly believe the hospital facility will change lives. It will reduce barriers to care, it will keep families closer together during difficult times, and it will allow more residents to receive the right care at the right time in the right place, here at home.
Well, I hope from what everybody's heard that these stories resonate with you. Thank you to the community for making this amazing project of a new build a reality. If it wasn't for our volunteers, donors, and the engagement of the community, we would not be where we are. Every dollar counts, and we are so grateful for every one of you.